Hi again, it's Bill Cavanaugh from Abscopalevents.com, where we are going to keep talking about the abscopal effect with regards to cancer treatment and possibly the emergence of a whole new way of looking at cancer treatment. In case you're new here, the abscopal effect is the observation of the regression or shrinkage of an untreated cancer, typically a metastatic deposit of cancer, following the treatment of a targeted and probably related cancer, often the primary cancer. And the abscopal effect that we are talking about happens in the absence of systemic treatment such as chemotherapy or hormone therapy. Those are not involved in the abscopal effects we're looking at. Now, once a person reaches that stage where cancer has become metastatic, the abscopal effect becomes a highly desirable outcome. I think that everyone can appreciate the idea that we can treat one cancer and see others shrink as being a very appealing idea. That's what the abscopal effect is. Our objective here at abscopalevents.com is to keep trying to understand why we are hearing more and more about the abscopal effect the past several years. And A, try to find out what therapeutic ideas are making it happen more often. And B, push for more meaningful research to keep this idea growing and this trend moving upward. In earlier episodes, we reviewed some cases that depicted some abscopal effects. And we are going to keep doing that and looking at cases and other reports. But I think it is important that we lay down some of the known science so everyone can always refer back to the foundations that have been established over the years. And if I seem like I'm repeating myself, it's only because some of this science is very reproducible and is very key to these observations, in my opinion. It might feel sometimes like I'm talking in puzzle pieces, but everything will start to fall together and make sense as we keep reviewing these cases. But simply put, it appears that many, if not most, recently reported abscopal effects in the treatment of metastatic cancer are observed following 1. Some sort of local treatment. We have talked about radiation therapy and cryotherapy in the past, but there's treatment of a targeted tumor. During 2, a course of immunotherapy. We are using anti-PD-1 immunotherapy as our example, and though there are others, we are focused on anti-PD-1 to illustrate the basic phenomenon. Immunotherapy, for the purposes of our discussion, is not a drug that targets and destroys cancer cells. Immunotherapy is a means by which the suppressive effects of cancer cells are obstructed, so that our lymphocytes that are able to recognize mutated protein and cancer antigens are unleashed on the cancer wherever it is. We're going to look a little bit more at this. Okay. The suppressive effect of cancer cells is depicted here and is something we will talk about again and again. Here you can see in the middle with the blue arrow, the cancer cell extend a signal known as PD-1 ligand towards our potentially lethal lymphocyte, the lymphocyte that recognizes the cancer cell and should destroy it. Instead, the lymphocyte is put out of business. In this slide, we have inserted our immunotherapy antibody as indicated by our thick red arrow and blocked this signal from the cancer cell. We've obstructed the ability of the cancer cell to stop our lymphocyte from working, okay? And with the suppressive signal removed, our lymphocytes regain their innate ability to knock this cancer cell out. And our focus here is on the idea that we possibly see the abscopal effect after this combination of therapies. 1, locally destructive, and 2, immunotherapeutic, leading, hopefully, maybe, to our abscopal effect. Now, there are steps I'm leaving out for the sake of simplicity, but we will keep filling in the blanks and the soft spots as we go forward. But here's the basic foundation. Now, I'm going to cheat a little bit in this episode and take advantage of a superb meta-analysis that was published in the journal Frontiers in Oncology last month, March 2026. Frontiers is becoming my favorite journal, by the way. Now, this meta-analysis was performed and written up by a group from an affiliate hospital of the Zhejiang University School of Medicine in Jinhua, Zhejiang, China. Certain scientists in China have really been impressive in exploring this abscopal effect front in terms of cancer treatment. We're going to borrow some of their work here because I think they make some amazing points. But first, we have to talk a little bit about what meta-analysis is. Without going into deep detail, this is a very well executed meta-analysis. Meta meaning after, which denotes a kind of numerical research that involves the authors looking backwards, after, at several clinical studies related to a particular research question. The idea is to combine or pool data from several studies in order to draw conclusions across a broader base of information than each of the studies would be able to do individually. So it's about combining studies, trying to draw conclusions. So first step, those conducting the meta-analysis select a usually large number of reports or papers from the overall literature using reproducible search criteria so that anyone can go back and repeat the same effort. It's all about reproducibility. Now, once studies are identified that meet these defined selection criteria, the results from all the studies are pooled and treated more or less as if the data were all collected at one time. This pooling of data allows for the generation of statistical entities that are meant to provide further ideas, hypotheses, and ultimately more focused clinical research. It's important to keep in mind that no approach to cancer treatment research is going to match the randomized controlled trial, the RCT, but meta-analysis, when properly performed, can provide strong support for testable hypothesis going forward. Okay, that's enough about the general notion of meta-research, but I would maintain that the group that carried out this particular exercise crossed all the T's and dotted all the I's in terms of complying with the formal requirements of contemporary meta-analysis. This group started with well over 2,000 studies that met their initial criteria, essentially papers that involved advanced gastrointestinal or GI cancers. Those include cancers of the esophagus, stomach, colon, rectum, liver, and pancreas. And these were all advanced cancers, either unresectable, metastatic, locally invasive. They were advanced cancers. These were not easy to treat. So that was the pool of the cancer types. Now, in terms of treatment, they were looking at studies that employed a certain type of radiation therapy known as stereotactic body radiation therapy, or SBRT, and immunotherapy. So, get to more of that. They also searched for abscopal effect, which is probably why we're talking about their work. And out of these thousands of papers, they ended up with 25 studies that fulfilled all the required criteria that related to cancer type and the involvement of SBRT and immunotherapy as treatment. These were studies that might contribute some solid information on outcomes of stereotactic body radiation therapy, or SBRT, with or without immunotherapy in the treatment of advanced gastrointestinal cancers. So, with all that set up, I'm going to zero in on two findings these authors made with regards to their inquiry and meta-analysis of these studies. So forget about procedure, let's look at what they found. Now, I'm picking two findings of interest to our effort. This is not all they found. I don't want to take anything away from them. But these two findings, I find, particularly relevant to what we're talking about here at abscopalevents.com. First, the authors found that when they compared SBRT, this radiation therapy, plus immunotherapy, the combination, to the controls that were in the data set, which would typically be either SBRT by itself or immunotherapy by itself, or they actually had a number of controls that were just chemotherapy. When they looked at the combination of SBRT and immunotherapy to all the controls, they calculated an odds ratio of 5.3 in favor of the combination SBRT and immunotherapy group, using objective response as the outcome. To put this in a little context, if this were a randomized controlled trial, the kind that get new cancer treatments approved, and an odds ratio of 5.3 was found, it would blow everybody's mind. It's a multiplier of 5. It's five times better outcome for one group over a control group. Now, we have to interpret liberally here because this is a meta-analysis and not a controlled trial. But the implication of this pooling of data and this meta-analysis is that combining SBRT and immunotherapy results in 5 times the rate of objective response as compared to SBRT alone or immunotherapy alone or standard chemotherapy as deployed in these selected studies. Objective response here means tumor shrinkage by and large. And again, this huge odds ratio is largely driven by patients in the pool who had advanced hepatocellular carcinoma, primary liver cancer. Now, when only liver cancers were considered, the odds ratio was about 4.7, which in the minds of these authors confirmed a, quote, profound synergistic effect of SBRT and ICIs, which is immunotherapy we're talking about in this population. Profound synergistic effect. Now, this is not the Abscopal effect, but the idea that combining these two modalities, radiation and immunotherapy, together resulted in such a dramatic advantage over any single treatment in the pool is worth noting. And it fits in with what we've been talking about in terms of activation of the immune system, which has somehow become dormant to these cancers, allowed these cancers to grow in dormancy, somehow waking it up and watching something synergistically happening between radiation therapy as destructive therapy and immunotherapy, as we just talked about a couple slides ago. Now, secondly, the Abscopal effect was observed in 26% of studies where SBRT and immunotherapy were employed together. 26%. And as with the objective responses over controls, the Abscopal effect was seen most often and in highest rates in the treatment of hepatocellular carcinoma, primary lung cancer. And all of these liver cancers were advanced or unresectable, often pretreated. So these were difficult to eradicate advanced liver cancers. And the Abscopal effect was induced a full quarter of them over these pooled data. Here's what I'm driving at in this discussion. Now, according to the American Cancer Society, we went over some numbers last time, more than 40,000 Americans are expected to be diagnosed with primary liver cancer, including hepatocellular carcinoma, in 2026, and over 30,000 will die from it this year. So, in the end, these authors make a strong case with their detailed and really well done meta-analysis that we ought to look very hard at hepatocellular carcinoma, primary liver cancer, as a target for study of intentionally provoking the abscopal response. Now, In their case, they studied the use of a combination of stereotactic body radiation therapy, or SBRT, something we can go over later when we compare different radiation therapy techniques, along with widely used immunotherapy. But all in all, these are some very powerful findings in a very difficult to resolve cancer. These findings are very difficult to ignore. Now, next time we will talk a bit about the economics of such studies, and we'll look at some new technology on this front. But for now, thanks for watching, and I do hope to see you next time.